It's about balancing.
And the use of due regard as a guiding principle.
Welcome to this episode. Today we're unpacking a detailed letter from David Charles Osborne, a retired U.S. Army Sergeant First Class and co-founder of ReadyRoom.life, addressed to Uber's government affairs, Uber Health, corporate responsibility, and legal teams. It highlights a critical operational failure in Uber's Veterans Transportation Program at Fort Campbell, a military community uniquely positioned on the Kentucky-Tennessee border.
Yeah, it's a fascinating case. The core issue is that Uber's platform currently restricts drivers from providing seamless round-trip rides across that state line under the federal VA contract. So veterans who live or have appointments near the border face barriers that can lead to missed appointments and delayed care. And given Fort Campbell serves the 101st Airborne Division and thousands of veterans and military families, this is a serious problem.
Exactly. The letter points out that Uber's driver app flags Kentucky licensed drivers as outside earnable area when they try to cross into Tennessee, and vice versa. This is rooted in state licensing and regulatory frameworks that typically govern ride-hailing within state boundaries. But here, the VA contract is federal, and veterans' healthcare needs don't stop at state lines.
Right, and that's the crux. The artificial geographic barriers created by Uber's platform undermine the Veterans Transportation Program's purpose. It's not just a technical glitch. It's an operational and contractual failure that compromises mission-critical veteran care.
So Osborne proposes a practical solution. Establish a 50-mile radius green zone centered on Fort Campbell. Within this zone, Uber drivers licensed in either Kentucky or Tennessee would be authorized to provide rides under the federal VA contract, allowing seamless round-trip service across the state line.
That's a smart approach. It reflects the real-world travel patterns of veterans in the Fort Campbell, Clarksville, Oak Grove, and Hopkinsville areas. Instead of rigidly enforcing state boundaries, this green zone respects the federal nature of the contract and the unique local geography.
It's a geographically bounded operational carve-out that balances regulatory compliance with mission effectiveness. And it's targeted, covering the typical veteran travel patterns without opening up unrestricted cross-state service.
What I find really compelling is the use of the aviation principle of due regard to justify this flexibility. In aviation, due regard means operators must conduct flights with careful attention to safety, mission requirements, and the environment, even outside normal air traffic control or international airspace. Applying that here, Uber should operate the VA transportation program with due regard for the unique realities of Fort Campbell veterans. The letter argues that state line restrictions, which work in civilian contexts, shouldn't override the mission-critical need to deliver reliable transportation under a federal veterans healthcare program.
That analogy reframes the problem from a bureaucratic compliance issue to a mission-driven operational imperative. It encourages flexibility and prioritizes veteran access to care, aligning Uber's operational decisions with the intent of the federal contract.
Exactly. It's a shift from rigid procedural limitations to responsible, mission-focused decision-making. And that's crucial when you're dealing with vulnerable populations like veterans who rely on timely healthcare access.
The letter also lays out clear requested actions. Osborne asks Uber to immediately implement the 50-mile green zone, confirm within 7 business days the technical and operational steps to authorize cross-state service, provide a rollout timeline with VA coordination, and lift the outside earnable area restrictions for qualified drivers within the zone.
Those requests emphasize urgency and accountability. Plus, Osborne offers to facilitate discussions with local VA transportation coordinators and veteran stakeholders, which shows a collaborative spirit.
Implementing this would eliminate current service failures, protect the VA-Uber partnership's integrity, and demonstrate Uber's commitment to veterans. It's a practical fix with real impact.
This case also highlights a broader challenge: the tension between state licensing regimes and federal contracts. Ride-hailing companies like Uber operate in complex regulatory environments, and border-straddling communities like Fort Campbell expose jurisdictional overlaps that complicate service delivery.
Right, and the green zone concept could serve as a model for other regions facing similar cross-jurisdictional issues. It's a way to operationalize mission-critical flexibility within regulatory frameworks.
And the use of due regard as a guiding principle suggests a shift toward more adaptive, mission-aligned operational frameworks in public-private partnerships, especially in healthcare transportation.
So, for companies like Uber, it's about balancing compliance with innovation and responsiveness to unique community needs. This letter calls for a pragmatic, veteran-centered solution that transcends bureaucratic boundaries to fulfill the federal contract's intent.
To sum up, David Osborne's letter is a detailed, well-argued appeal to fix a critical operational failure in Uber's VA transportation program at Fort Campbell. The proposed 50-mile green zone, backed by the aviation principle of due regard, offers a practical, mission-focused solution to a complex regulatory challenge.
And it reminds us how important it is for public-private partnerships to adapt operationally to serve vulnerable populations effectively, especially when federal contracts intersect with state regulations.
Absolutely. It's a nuanced issue with real-world consequences, and this letter lays out a clear path forward.
Thanks for diving into this with me. It's a great example of how operational flexibility and thoughtful policy can come together to improve veteran care.
Yeah, thanks. It's been a really insightful discussion.